increasingly, the health of people are dependent upon the health of the planet.
We are undermining the integrity of our environment at a very rapid pace.
The rainfall is no longer regular the way. Sometimes they come too late, sometimes they come too early.
We convened experts from different fields from around the world. What emerged from that conversation was the need to take into account the environment, climate change, and its impact on human health. From that emerged the idea of pulling together a commission, together with the Lancet, which has now issued its report last year that's really a call to action.
So this just gives you a very brief summary of the environmental trends that we noted. Dramatic tropical forest loss, water shortages because many countries are exploiting their finite water sources, and of course overarching all this is the challenge of climate change.
And so what our report tried to do was to show how this could undermine the progress in human health we've seen in recent decades. But more than just sounding the alarm, we also wanted to propose some potential solutions, some ways forward.
We have to learn what the policy needs, priorities, and gaps are for science. What are those priority issues where the science can be produced to help deliver the results and input on how we can do together science education to build this community of communities of practice.
Knowledge action networks really are the tool that Future Earth has come up in order to implement its mandate to co-design and co-produce research.
We've started some months ago to reflect in UNEP at how we could help address the environment and health linkages. So you have a very interesting set of SDGs, and it's quite an interesting mandate that the member states have accepted too.
We launched the Our Planet, Our Health initiative, and this initiative commits to investing £75 million over the next 5 years in the developing field of planetary health.
There's so much work that is going on, but the problem is it's only happening at the technical level. So much has been done in terms of laws and policies, but very little has been done in terms of the implementation.
Part of the leadership on this question is in Africa. So we have in Nairobi, for example, the APHRC is one research institution in health that's a leading proponent of planetary health. And it's a natural source of leadership for this new field going forward.
I'm really struggling with the challenge of national development goal. Most economies are building on exploitation of natural resources. Where is the balance?
That seems to me to be a crucial area now to develop a financial system and a tax system which reflects these long and short-term impacts on the environment.
What is the role of young people in promoting the whole idea of planetary health?
The work of the Planetary Health Alliance is also focused on science education, and that means learning what's needed in terms of how to teach that effectively, using innovative materials, methods, social media.
The Sustainable Development Goals, there's 17 of them that span so many issues. So it forces us to think of multi-sectoral, multidisciplinary solutions to problems. We can't solve them one by one to get to 17. We need solutions that combine the needs in all of them. And I think planetary health provides that kind of framework.